Do you know what is the serious most problem in Ayurveda today? Nothing else than the faulty education. Education in professional colleges, starting from the top rated Ayurveda institutes across the country to the lower ranked institutions. The situation is same. There is no standardized way of comprehending a science which is a deterministic science. Deterministic science means the basic facts are already proven and established. Basic logics, theorems, principles, everything is proven and established by causal reasoning within the science of Ayurveda by ancient scientists. And they have given us a very accurate map of approaching a disease and a patient. No disease starts with this medicine in that disease or this treatment in that disease. It's not written like that. There should be clear cut translational research happening to understand the modern age diseases, infections. For example, infections are managed, even infections are understood in variable ways. We know COVID 19 is a respiratory infection. In South India, it was understood as caused by krimis. In some parts of India, not only South India, in Kerala, even in Kerala alone, the physicians were confused what kind of disease it is, the nature of disease, nature of cause mechanisms, nature of immune manifestations happening within the body in that particular infection. It has to be studied with Ayurvedic principles. Then only there will be clarity in Ayurvedic diagnosis and management. That is not happening. All the some are treating for krimis, considering that germ theory is there in Ayurveda. Some are treating with for doshas in infections. What exactly is infection? That is to be known. No, in Ayurvedic perspective, and different kinds of infections, variability is there in diagnostic and treatment approach. This is not known in any Ayurveda colleges. So what will happen? Faculties will teach something and physicians will emerge prescribing this medicine for fever. Many medicines are mentioned in Ayurvedic books. But as I told, Ayurveda explains a very wholesome, comprehensive approach in understanding fever as an independent disease. What all cause mechanisms can lead to fever. A very detailed explanation is there given in the Samhitas, led by research. How you can say led by research? Causal reasoning oriented research. When we are applying those 5000 years old principles today also, I can reverse dengue fever very confidently, no matter patient is in any status, any state and stage. And I am not doing it with herbs or random formulations. I have a specific direction in SBEBA, how to approach the patient, how to handle the patient. Similar is the kind of cough or asthma. Cough medications and asthma medications are blindly prescribed. That is not the way. What is happening in that cough? What led to cough? Or respiratory infection or allergy or any cardiac causes or gastrointestinal causes. What has caused cough? It has to be explored in Ayurvedic perspective. It's not like one medicine for cough, one medicine for diarrhea, one medicine for liver disease. BP, anybody who checks BP medicine in Ayurveda, Sarpagandha will come. Sarpagandha is not mentioned in Ayurveda. Cardo stab, some irrational formulations where many medicines are combined and some trials are done with, so many people it is administered, benefit risk ratio is calculated and it is emerging as medicine for BP. It is stupid because hypertension has to be understood in Ayurvedic scientific perspective. Every person, hypertension can be by variable cause mechanisms, need not be same. So what are the standardized cause mechanisms that is causing essential primary hypertension? There should be a map for every physician to learn and adopt. And what is to be done in BP? It is not suppressing BP, that is the approach in Ayurveda. It has to be normalizing or resolving BP and enabling the patient to reach such a state where he doesn't require any more medication. So this is the objective of treatment in Ayurveda. This is the objective of diagnosis of Ayurveda. Ayurvedic diagnosis differs from modern medicine SBBA, we are having all these how to approach a patient with modern age. Multiple ailments can be there. Single ailment also, patient might be on multiple medications for stroke, paralysis. How stupid treatments are delivered in Ayurveda colleges. Everyone will undergo Panchakarma treatment or pH chill and all these things, Virechana, all these things. How stroke emerged in that particular patient, the cause mechanisms behind what is happening, that has to be explored in Ayurvedic perspective. And there is absolutely no need of all these oil therapies in stroke or Panchakarma treatments. Psoriasis, Takradhara is effective in psoriasis. Maybe some symptom improvement will happen, but that is not the scientific treatment of psoriasis in Ayurveda. Autoimmune conditions, metabolic imbalance, thyroid dysfunction. Simply some Kanchanara Gugulu like medications are administered. PMOS. It is considered to be like, without understanding anything, amenorrhea. Suppose PMOS patient comes with amenorrhea. To induce menstruation, medicines are given. It's not to resolve PMOS. So it has to be understood, understanding in the scientific perspective of Ayurveda. This is commonly happening in all diseases. Every disease, can you imagine? There is not even a single college or a single institute which is following a standardized approach of clinical decision making in Ayurveda colleges or Ayurveda hospitals or Ayurveda clinics. Anything can be done by any qualified Ayurveda physician, and patient is bound to trust that treatment and go ahead. Fate of the patient, because he cannot understand, even the physician has no clarity. That is why in between treatment it is aggravating. The physician is not able to predict anything. Anything can happen, multiple medicines, all these are happening. So SBEBA or science-based, evidence-based Ayurveda has done 20 years of continuous basic and translational research with Ayurvedic fundamental principles, and we have emerged diagnostic and treatment standards for all kinds of diseases which are prevailing in society today, and also standards to integrate multiple kinds of diseases which are happening at the same time in patients today, with which a physician can attain clarity in the science and practice of science-based medicine. He can refine and culture his intelligence. He can keep learning the principles of Ayurvedic science-based medicine and advance in quality that is delivered to his every individual patient. This is the need of the hour. Honorable Prime Minister of India, Namaste, and also all the policy makers of Ayurveda, please consider my video with utmost seriousness. Somebody has to say this, and I believe I am authentic to say this because there is a background research done by me and my husband, Dr. Rajkumar, in this, which has enabled us confident to speak this always. We feel very sad to find this irrational mix of treatments and diagnosis, aimless diagnosis going on in Ayurveda colleges. We have enough time to rectify. We have enough time to update. But the earlier the better. So let's do it for the sake of generations of doctors who are to emerge in this Ayurvedic science. Thank you.